Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. Study finds parental alcohol use disorders linked to accelerated aging in children. In a recent published study journal in the Aging and Disease have discovered that parents who struggle with alcohol use disorders can pass along symptoms of early aging to their children, affecting them well into adulthood. The accelerated aging effects such as high cholesterol, heart problems, arthritis and early onset dementia that can be inherited from either parent individually. However, they become more severe when both parents struggle with alcohol abuse, particularly in male offspring. As adults get older, they develop a biological condition called senescence, which is when cells slow down and stop dividing, limiting the body's ability to replace deteriorating cells. Using a mouse model researched by Golding and his team revealed that senescence also happens to be one of the early aging symptoms that offspring can inherit from parents who daily drink alcohol to the legal limit or more. Study finds Mediterranean diet help reduce perceived stress. In a recent study published in the journal Nutrition and Health, Mediterranean diet versus the traditional Western diet make you feel like you are under less stress. According to a new research conducted by a team from Binghamton University, State University of New York, the findings suggested that people can lower their perception of how much stress they can tolerate by following a Mediterranean diet, said Lena Begche, Associate Professor of Health and Wellness Studies. The Mediterranean diet, rich in plant-based foods, healthy fats, and a variety of natural colors, emphasizes wholesome nutrient-dense options. This stands in stark contrast to Western diet, which is characterized by high glycemic, low-quality processed foods. While the Mediterranean diet is well known for its positive effect on both mental and physical health, its impact on perceived stress, how much stress one can feel at any given time, remains less understood. Study finds anxiety linked to a threefold increase of dementia. In a recent published study journal in the American Geriatric Society, both chronic and new onset anxiety are linked to a threefold increased risk of dementia onset in later life. A total of 2,132 participants with mean age 76 years from the Hunter Community Study were recruited. Anxiety was measured using Kessler Psychological Distress Scale. Dementia was defined as per International Classification of Disease 10 codes. The fine grained subdistribution hazard model was computed to assess dementia risk while adjusting for the competing risk of death. Study finds no increased risk for transplant patients from donor kidneys with Toxoplasma. A recent published study in the journal Transplant International, researchers have found that transplant patients who received kidney infected with the parasite Toxoplasma had virtually the same outcomes as those who received Toxoplasma negative organs. Despite long-standing concerns, those who received kidney from Toxoplasma antibody positive donors had almost identical mortality and rejection rates. Toxoplasma is a ubiquitous parasite that infects many people but generally causes no harm. However, people who are immunosuppressed, such as kidney recipients, could be at higher risk. Toxoplasmosis can be transmitted through the transplanted kidney and reactivate a latent infection in the kidney recipient. Still, there has been tremendous inconsistency in how transplant centers treat TPD kidneys, with some accepting them and others rejecting. That's all for now. Stay tuned for more updates in Medical Dialogues.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.